All right, my name is Katie Relf, and the title of my poster is Integration of Bedside Shift Report Among Nursing Staff on Medical and Surgical Units. So my PICO question states, in patients on medical and surgical units, how does bedside shift report compared to traditional shift report outside of the patient's room affect patient care throughout the hospital stay? So I think it's really important to look at this topic of bedside shift report due to the possibility of improving both patient safety and patient satisfaction. So a little bit of background, nursing shift report has often been done away from the bedside, either at the nurse's station or sometimes even in an office setting. Research shows that both nurses and patients show a preference for report being done at the bedside. And with that being said, there is also a lot of pushback from nurses who don't want to do it. And they have, due to concerns of either breaching confidentiality, patients sleeping during the time of shift report, patients who have sensory or cognitive deficits and aren't able to fully engage in report, and a perceived disruption in communication flow. So from the research that I did, one study showed that fall rates decreased by 35%, and there was a 50% reduction in medication errors. Another similar study showed that number of falls with without patient harm, decreased by 9.37%, and there was a 75% reduction in pressure injuries. And another study showed that when SBAR, the situation background assessment recommendation method, this is just a streamlined way of communicating between either nurses or even providers, just to reduce distractions and really focus on that important essential patient information. So this study showed that when this method was used, they were actually able to cut down the time of report from 40 minutes to about 10 minutes. And then next, we also, kind of like I mentioned before, conducting report at the bedside has improved both patient and nurse satisfaction. And unfortunately, I couldn't find any research relating to COVID-19 yet in bedside shift report. I think that's something that will have to come a little later on down the road. But basically, to summarize, when bedside handover is used, there is improved safety, it saves time, and there's an increase in both patient and nurse satisfaction. So for QSIN competencies, I really focused on EBP, evidence-based practice, safety, and patient-centered care. So I feel like evidence-based practice and safety kind of go together. You're focusing on the research and you're using that best practice to promote patient safety. And whenever you're using bedside report, you're really creating that culture of safety where there is a lot more accountability between nurses with doing checks on orders, checks on IV pumps with both nurses in the room, just general safety concerns in the room that you have two people laying eyes on at the same time. And then I also chose patient-centered care because when you're having that exchange at the bedside, you're showing respect and you're having that clear communication with not only another nurse, but also with your patient, which is allowing them to stay more informed and feel like they're having more of a say in their plan of care. So my recommendations for future research, as I was researching this topic, I had a hard time finding original research or very much statistical research. A lot of what I found was either literature reviews or surveys that either asked opinions from patients or nurses or asked what barriers they thought there were to doing report at the bedside. And also, I think it would be very interesting to see the effectiveness of bedside shift report on other units, for example, either ICU or even labor and delivery units, and see if they have those same improvements in safety and reduction in medication errors. And then finally, I think it would be really interesting to see the effects of COVID-19 on just general communication and bedside report too, on both medical and surgical units. So to conclude, although there are several benefits to doing report at the bedside, there are most likely always going to be nurses who don't want to change their practice. There's probably always going to be a little bit of resistance, but that's why we really have to focus on what is evidence-based and what works the best. And then kind of as I mentioned before, patients often tend to prefer report at the bedside because they feel more involved in their care and feel like they have more of a say. And safety is improved through that decrease in fall rates, decrease in medication errors were the main things that I found in this research. And then also with the time reduction, when using that SBAR method, it led to a decrease in overtime costs, a decrease in legal costs from the decrease in falls and medication errors, and it also led to an overall increase in nurse satisfaction. So that concludes my poster. Thank you.